welcome to Pick Yourself Up. I'm Assegid Habtewold, your host. Today, I have a special guest. His name is Dr. Wondwossen Gebreyes. He is the Executive Director of Global One Health. He is a very successful researcher and a leader by his own right. He advises governments like the United States, Saudi Arabia, Australia, UK on global health. I'm glad that he is here today to talk about his immigrant stories, what he has been doing so far to also empower some communities back in Africa and also here. Dr. Wondwossen, thank you very much for coming.
Very welcome. Thank you so much, Assegid, for having me and all your team members. Great to be here and share my perspective.
So you have achieved a lot of great things. We may not even have enough time, if we cover everything that you have achieved. But for the benefit of our audience, do you mind to quickly summarize your story? When did you come to the US and what you have been doing so far?
Yes, very happy to. So I came to the United States 25 years ago, actually, September of 1995. I'm originally from Ethiopia. My background is in veterinary medicine. I graduated from Addis Ababa University, one of the premier universities in Ethiopia, practiced veterinary medicine in Ethiopia and moved to US back in 1995. And my journey has been, just like any immigrants in the US, has been up and down, full of stories and various challenges, successes, setbacks, and so on and so forth. But I'll be very happy to share my perspectives, definitely, as our time allows. Within the last 25 years, in fact, originally, as like many Ethiopian immigrants, I lived in Washington, D.C. metro area, particularly Maryland area, Bethesda, Silver Spring, for the first couple of years, then moved to North Carolina to join my PhD program at North Carolina State University in Raleigh, North Carolina. And about 14 years ago, 2006, I moved up north to the state of Ohio. I am in Columbus, Ohio currently as a professor as well as executive director, as you mentioned, addressing global health-related issues as executive director of Global One Health Initiative.
Thank you. So let's start first from your personal story, and then we'll talk about global health, Global One Health. Every immigrant, myself, had that experience. Every immigrant had some kind of challenges as they moved to a new culture, some financial, some status related, some health, family related. In your case, what were the major challenges that you had in your earlier stay, and how did you overcome them?
Yes, thank you so much. Yes, this is a very important question. Of course, the first time you moved into a new country, a new culture, a new setting, there are many challenges, and I faced many challenges. The first one being the cultural shock. It's a huge difference coming from Ethiopia. Even though I grew up in the capital city, born and raised in Addis Ababa, I came from a very rural south part of Ethiopia directly to Washington, D.C. So there are so many differences, cultural shocks. Secondly, really, getting from a professional life, a highly respected doctor in the southern part of Ethiopia, moving in the US system, and nobody considers you really anything. And to get into the professional life, going through, like anybody else, through a non-professional life as to really survive and earn to be able to feed yourself and get into the educational system of the US. There has been many challenges. First, after I moved to Washington, D.C. area or US in general, I had to really accept the challenges I faced, and I started various types of job activities, such as many Ethiopian immigrants do, parking lot attendant, being In fact, I failed my test for a DC cab. I tried to be a taxi cab driver and failed the test. And there were many challenges. But, of course, challenges exist. There were challenges. There is a challenge now. There will be challenges in the future. But how you handle challenges is what matters. I always looked at challenges as opportunities. There are always silver linings that comes with every challenge. So I was able to really pick myself up, as I like the title of your program, really pick myself up in every step. There are setbacks, but there are no failures. There are always opportunities to learn a lesson, improve myself. Everything I did prior to, but since I arrived in the US, have always been instrumental in my next step of my life. The lesson I learned being a parking lot attendant in DC area, but later on I moved up to the NIH campus in Bethesda, in fact, purposely, because my goal down the road is to be a health expert. So being a parking lot attendant at the NIH campus, right on, I think it was Wisconsin Avenue on Rockville Pike, was very much instrumental to me. And I learned a great deal of how to be humble. It teaches you lots of things. It taught me a great deal of humbleness, and not be the big boss doctor like in Ethiopia, but rather, moving cars for some people at NIH at the same time, studying hard to pass my GRE and other exams. But there are many stories. I'm happy to share my perspectives from that.
Thank you. It's really a very humbling story. I knew you starting from, I think, 2000 when I was still in Ethiopia. I remember how supportive you were. I don't know what happened, why I didn't get here, but I remember you were trying to give me opportunities to come to the US before I even came here. So I know your heart, and because you have been passing through a lot of challenges, you're very, very helpful to others. I want you to advise people who are maybe struggling right now. Their vision could be to be like you. You are now one of the top dogs in the science field. You are leading a global institution and advisor to governments around the world. So if there are individuals who want to be like you in the area of science, research, but right now maybe they are down, they may be underdogs, not having a lot of opportunities, do you have a couple of tips that you would like to give it to them?
Yeah, definitely happy to. Yes. In fact, one of the things I noticed right when I came to the US, and some people I came across or I met in the metropolitan DC area, was some of them are very highly capable, renowned professionals from Ethiopia, highly senior leaders in Ethiopia that I have known before, and who were really doing not up to their potentials at the time. My advice is, I think, first of all of us, find your own path or be yourself. That is really a basic principle, but very important thing. Secondly is really persistence. What really helped me a lot is there is no discouragement in my life, and for some reason I think it's my nature. But if I looked at some of the senior people before me who came here and they were not really doing well, and I'd be discouraged, or if I have not persisted, that would have been not a good thing to do. So I really advise people who are new or immigrants coming to the US, it doesn't matter from which country, is really to be persistent for your dreams and don't be discouraged. But it's be authentic, be yourself. The third thing I would like to say is information is so crucial. The first time I came, you get so many information from people, an Ethiopian guy walking the street, or on Adams Morgan area, or so many places, they give you so many different advices. But I always looked for the right information. Information is crucial. Starting from settling up and getting my green card, or getting into universities and getting into the US system, information is so critical, but the right information is critical. Getting the accurate information from the right place. I remember I go to the different places in Arlington, other places, the right office to ask the specific question rather than my cousin or my distant cousin who tells you one thing and assumes something. There are many people I can tell you who told me, oh, your Ethiopian degree, your Ethiopian doctorate doesn't work in the US. It does work. Whatever country you are, you may have to pass some some steps on the way, but it does. Everything you do really helps a lot. So, that information, getting the right information is crucial and critical, and keep your integrity. Sometimes you may want to do the right things and you might be challenged. If I do it this way, it may work this way. I don't think you want to recreate yourself or the mechanism. I always kept my integrity. I do the right thing in the way that it may look like it's going in the wrong direction. Those are the few tips I would like to give people.
These are really great tips. I want to emphasize that last one because it happened to me too, because when I came to pursue my master's in computer science, there were really good meaning friends and colleagues who were advising me that don't go there because even if you get graduate, you may not be able to use your degree because in the United States, you will never work in the area of your passion. I understood that they had frustrations. They actually introduced me some of the people who got some advanced degrees, but they couldn't be able to get jobs in the area of their profession. And they were trying to help me, don't waste your time, don't waste your energy, your money. Why don't you just get jobs wherever you find your hands? And somehow I felt like that was really not a good advice, even if I appreciate they cared, even if I understand the situation. But I decided, you know what, I will continue. And I'm glad that I could be able to finish it, because if I heard wrong advices, I wouldn't be here today. So one thing I want to encourage people who may be listening to the wrong voices is that education matters. Give your best, try your best. This is a land of opportunities. If you work hard, if you give your best, you could be able to become successful and become like Dr. Wondwossen, who is now a global advisor in the area of global health. So thank you very much for sharing that. Let's take a quick break and we'll come back to continue our conversation. Please don't go away. Stay tuned.
Because the fight isn't over yet.
You will see me choose to protect my community by wearing a face cover.
And even with my face covered,
you will see me.
As a son.
As a man with a never quit attitude.
As a fighter for change.
Join me in wearing a face cover.
To help stop the spread of the coronavirus.
Because this is one small act of kindness
that has the power to make a big difference.
Welcome back. This is Pick Yourself Up. I'm your host. Today, I have a special guest. His name is Dr. Wondwossen Gebreyes. We've been talking about his immigrant stories, amazing, really transformational stories about where he did start his journey in the United States and where he is now, a very envious place to be. We're going to continue to discuss about his also involvement with Global One Health, his work in regard to COVID-19 and so on and so forth. Dr. Wondwossen, let's continue our conversation about the last question I have about your immigrant story is that there may be some people who don't really appreciate the values that immigrants add to the U.S. economy. Considering yourself and many successful immigrant professionals, what do you think are some of the contributions of immigrants for the U.S. economy?
Yes, that's, I think, very important question. As the United States of America is built upon immigrants, the difference might be whether you are first generation, second generation, whether your great-great-grandparent came from somewhere else, but it is heavily built by immigrants. First, I think recognizing that to all of us as the United States citizens is very important. Secondly, of course, if you look at data on many highly renowned, successful stories, be it Albert Einstein or many other Nobel prize winners are many are immigrants. And again, US being a land of immigrants, and all of us have stories of where our parents or grandparents came from. So this nation is founded upon immigrants throughout its history, predominantly respecting the Native American population, of course. So absolutely, immigrants play a critical role. Even if you are a recent immigrant, there are so many success stories in many different fields: economically highly successful, scientifically highly successful, and groundbreaking investigations in the medical field, in engineering field, in many other areas. So I think there is a consensus, and where we all agree that immigrants contribute tremendously to this nation. So anyone who is a recent immigrant need to be empowered. We are all in the same boat, this melting pot. We are part of the United States of America, and we should be proud to be, even if we are migrants. I'm a naturalized citizen. One thing you cannot be is the president of the United States of America. But I think as long as you work hard, that is the beauty of United States. It's a land of opportunity. As long as you work hard and you do the right things, you contribute to society tremendously. People individually or collectively can be highly successful. You cannot be president. So, yeah.
I completely agree. Let's talk about Global One Health. You are the executive director of the organization. What are some of the things that you do in a nutshell? What are the most important things that you're doing, especially in regard to COVID-19?
Excellent, thank you. Yeah. So Global One Health initiative is one of the areas where we address health-related issues, but at the interface of many other factors. Right now, the world that we live in is highly complex. Many issues are interrelated to each other. We live in an interrelated, interdependent world. Really, if you look at the population travel, air travel every day, I mean, this is 5-6 years ago or maybe longer, every day, of course, before COVID, more than 1 million people land in the United States. And from the United States to Europe, to Latin America, to Africa, and others. If you look at the food trade, lots of the salad or meat or anything we consume gets imported from different parts of the world. In fact, the National Academy of Sciences data shows there is a very nice interactive map in the National Academy of Sciences website, a bowl of salad that we consume in average Silver Spring, Maryland restaurant or so, the ingredients can originate from up to 33 countries. So we live in a highly interrelated world. What Global One Health addresses is disease issues at the interface of this. It could be foodborne diseases, it could be vector-borne diseases, it could be cancer, and so on and so forth. But about 3/4 or 75% of diseases that originate on humans currently in the world originate from animals or from some type of vectors, insects, and so on. If you think of the recent examples like Zika virus, you heard it, Ebola, and many others we all heard are of animal origin, from wild animals, or food, or insects, and so on and so forth. Coming to COVID-19, COVID-19 is not an exception. COVID-19, coronavirus, or in general, we knew it for a long time, and it's a common organism, virus, but this particular strain, SARS-CoV-2, that causes COVID-19, originated and really survived in wild animals for a long time. Other coronavirus also do the same. So we at Global One Health Initiative, and I can tell you more of what we do on COVID-19 more in greater detail if we have time, but we address proactively preventing pandemics from happening or epidemics, infectious diseases, cancer, environmental chemical hazards. We build capacity. Our focus is building capacity in a mutually beneficial way. We are global, we're not just international. Global means it starts from your local situation, be it in Maryland, be it in Ohio, be it in Washington, it could be urban or rural communities. How do you connect problems of local significance all the way to the international, regionally, nationally and internationally? So we work with many countries, governments addressing these issues at the interface of human health, animal health, environment, including COVID. The world is lacking capacity. There is a great lack of capability addressing these complex issues. So we built programs since 2009 in a mutually beneficial way, working with various countries, nations, as you already mentioned it earlier, but benefiting the United States. I'm in academic system, the universities, but also I work on review. I work with NIH on review panels. I come, or sometimes, many times, we do it on video. We work with the CDC, Center for Disease Control and Prevention. We work with Ethiopian government. We work with Kenya, Brazil government, Asia, and others addressing these issues. So COVID is very important, but for us, it's not unexpected. It's not a surprise for many of us who work in this area, but the world needs to have a better preparedness to addressing these issues.
One of the things that you mentioned is about capacity building. I know you are a great leader. So what's the place of leadership in terms of fighting pandemic and other diseases at global level and also locally? So let's talk about leadership, the place of leadership.
Yeah, excellent. Very good question. Many of us could be wonderful technical in some areas, right? It could be public health, it could be engineering, it could be many other social sciences, other disciplines. For us, whether we work in the United States, in Africa, or different places, just knowing the technical capability is not sufficient. The intellectual capability needs to be matched with emotional intelligence, matched with effective communication. There are many cross-cutting issues. We call them, clustered in adjunct skills or, leadership, like you said. It's very much critical. In fact, in our program, on every program or project we do, we embedded leadership and associated things, communication, ethics, mentorship, and many other issues. When we use a model system, I can give you one example. When we established a partnership between Ohio State University and the Ethiopian government, one of the things we used was a model disease. What is a low-hanging fruit disease? We can easily show success, but can establish a system for a new future diseases such as COVID-19. So the Ethiopian government selected rabies. Rabies is fairly old disease in the US, not much burden, but still kills more than 1,400, particularly children in Ethiopia. As we established that, really to prevent and control rabies in Ethiopia, we needed about 16 agencies, Ethiopian government. The challenge is, the Minister of Health is expert on some area, the animal health industry is expert in one area, environment is in one area, but they don't communicate each other. So how do we foster cross-interaction? So we created a meta leadership plan. That meta leadership plan allowed working across administrative boundaries, working effectively across discipline boundaries. So that is really critical. Now, fast forward after 10 years, these organizations are already established working together, established effective leadership. Now with COVID-19, the same model we established is tackling now, mitigating COVID-19 in Ethiopia. So leadership is critical. It's one terminology, but when you delineate it, there are so many things in it that are highly critical. So
especially, this is very important in times of crisis, because one's leadership gonna be tested, and if organizations, communities, and nations, if they don't have leadership in place, crisis may expose some weak links. And I believe that especially this global pandemic showed the importance of leadership. So what advice do you have for leaders around the world, especially those leaders in health? What are the key leadership capacity they need to develop?
Yeah, excellent. Very good question. So let me answer it in a few different ways. One critical challenge I see working within the US as well as many countries is confusing leadership from authority. Leaders are not necessarily authorities. You may have a boss, it's a boss, it's a boss. We all have in our own rights leadership capabilities. I always advise my own team members within the Global One Health Initiative. Everyone within their assigned roles, we are leaders, right? So it's not just the authority levels and where the hierarchy the person fits. I think recognizing that and empowering people to play a lead role within the capabilities or within the roles, identified roles is crucial. The second thing is, you mentioned it briefly, which is very important, is of course, true leadership is tested during the crisis time. It could be disease crisis or other, there are many crises we face in academia, in the university settings, for example. Leaders are being tested with this in crisis times. I think, first of all, people have to recognize that every crisis brings really opportunity. In a way, true leaders shine during crisis times. You really show how you can lead. Perhaps let me use him as an example again, and being in Maryland is, think about Dr. Anthony Fauci. Dr. Anthony Fauci, I knew him for a long time. He visited Ohio State 2-3 years ago. He advised us on some things that we established Infectious Disease Institute. But majority of the population, you wouldn't know this wonderful leader, right? But the moment COVID-19 came, the leadership of Anthony Fauci is tested as the director of the institute, the National Institute for Allergy and Infectious Diseases, NIAID, which is one of the big institutes of one of the 27 big institutes within NIH. So here leadership, he was able to manifest and show leadership across the country. It's not about the authority, who is the country's vice president, president of the nation. We know who is leading COVID-19 mitigation. So I really want to advise people that these things. Number one, really leadership is not authority. You don't need to be assigned to be called director or something. Secondly, take crisis as an opportunity to really prove your leadership abilities. And of course, for that to happen, there are many things within crisis management. Effectively communicating is part of the leadership. How you assemble a team, how you build a consensus. I think learning many of these things, effective communication, building a consensus, how to empower others. There are many other topics I can think of, but these I think are critical.
I wish we have more time, but we don't have any time. But I want to give you the opportunity to share how people could be able to reach out to you. Do you have a website or email that people may reach out to you if in case they want to talk to you?
Yes, absolutely. I'm very happy to talk to people. And my email address is Gebreyes.1 at OSU, like Ohio State University, osu.edu, Gebreyes.1 at osu.edu. And our website is globalonehealth.osu.edu. So I'm happy to hear from people if they're interested.
Thank you very much on behalf of our audience. Really great things have been shared in this conversation. I hope you have taken a lot of things out of this conversation. Thank you very much for watching. Please remain connected with us. Suggest who we need to interview, topics we need to cover, questions we need to ask. You can use our emails, reach out to us using social media and so on and so forth. Remain engaged. Until I see you next time with another interview, have a great time. Thank you very much for watching.
Thank you so much. Thanks for having me. Okay, have a wonderful day.
Thank you.